welcome our speakers today. Dr. Gautam Lard, oral surgeon and implantologist. Dr. Indu Balani, consultant dermatologist. Dr. Bhaskar Mukherjee, senior consultant psychiatrist, founder and director of Neuromax Healthcare. Dr. Mamta Shah, clinical psychologist and psychotherapist. And Sudhir Mishra, founder and managing partner at Legal Trust. Hello, everyone. Thank you so much. Thank you so much for joining us and taking time out of what I can only imagine is an incredibly busy schedule you have. I mean, right now we're in a situation where it's all hands on deck. Everyone is working 8 hours without food, without going to the bathroom. It's an incredibly dire situation we are in. And even if you're not working on the field, everyone is engaged 100% of their time trying to find resources, talking to people. We all know someone or are someone who is right now suffering. So thank you so much for being here today and also for taking time out of your day to speak with us.
Thank you, Vasudha. Good evening, everyone. I'm Kavi Bhandari, and we're just going to begin the podcast in a minute or two.
Kavi, we're already live, so I would suggest you continue, and when the other speakers join, you can start engaging with them as well.
Sure. First of all, I would like to appreciate and with great gratitude the medical fraternity and all the doctors who are doing such a great job risking their health just to make others feel much better and cure others and help them in this difficult time. So I would like to appreciate and give gratitude to all of you. I would like to start with Dr. Bhaskar Mukherjee. Dr. Mukherjee, what do you feel? How can we strengthen the healthcare system?
For that, we need to have our huge budget allocation, and along with that, we need to have full government support, be it state government, be it central government, and we need at present huge bed space. For that, if possible, convert the public auditoriums, public stadiums into hospitals so that we can get beds, because 99% of patients with COVID, they need a hospital bed and oxygen. If only the last 1%, they are the vulnerable ones. For them, we need much more than oxygen and bed. But for initial ones, those who are admitted, we don't even know how to admit them and give them a bed. It's a horrible condition. We can't find empty bed. We can't find enough oxygen.
Absolutely, like strengthening the actual infrastructure, having more places for patients to go instead of going to the hospital, which should be reserved for more dire situations. We need to absolutely do that. And you are right, the GDP needs to go up. But, can we add on to that? Dr. Indu Balani, would you like to?
Considering the present situation, I agree with Dr. Bhaskar that we are like in a very kind of life and death situation with the hospital beds are so less and oxygen deficiency and everything. But still, I think we need to take like more of these by teleconsultations. More personnel should be employed who can actually console patients, because for some it is kind of a panic-like situation when the oxygen starts going down and then they start panicking and it further goes down. So there should be some kind of at-home management also up to some level, which of course people are doing, but it should be at a better, more informed level. It's not just some WhatsApp forwards which people are reading and then take this drug or that drug. It should be more informed. More doctors who are not actively working should have certain patients allocated to whom they can do a daily call, or a video call would be more appropriate, and then kind of consoling those people. And like in this way, they can actually decrease the hospital load also to some extent.
Yes, absolutely. And you are right about the whole panic thing that is definitely spiraling out of control, because we read one thing and then we immediately go to warn others, and then those will warn 10 others, and it's like the situation that just keeps on, like a domino effect. And that panic is taking over us more than probably, and it also affects us physically, right? And I think this would be a good time for Dr. Mamta Shah to also come in. Like, what can we do about healthcare infrastructure in not just the physical places we need to build, but also, in the mental healthcare space?
So I think one of the important things is if we look at it, the insurance agencies that we have, whether it covers mental health services or not. The thing is that I think in 2017, there was a Mental Health Act that basically said that the insurance companies should include mental health services within their framework. And I think the Insurance Regulatory Development Authority of India also did give all of the insurance companies, I think, time till 2020 October to pass a circular that the mental illness should be included and not excluded within the package. But, as we know that it's difficult, right, to kind of assess as to how much therapy or how much, does a person require. I think all of the insurance companies and agencies are still finding it difficult to really have a special mental health care package within the framework, So it's within the normal physical ailment package, but not really. That I don't think there's any standalone package per se. And most of these packages, they include inpatient, care. That is, in case, for example, if you've got, let's say, depression and anxiety, and you've got hypertension due to that, then maybe, yes, they will, kind of consider it. Or because of that, you've been hospitalized, and of course, they will consider it. But outpatient, in the outpatient department, I don't think there's any clear indications as to whether they, they give it or not.
Yeah,
so we're still lagging behind that. And that's why I think most people aren't able to get the services that they want.
So I think a lot of people don't even know that the services are out there.
Yes, they are out there.
They are out there, and there's quite a lot of it out there. I mean, we have two panelists here today to talk about it, and I would love Dr. Mukherjee's input. But before that, I would like to get Dr. Gautam. Are you there?
Yes, I'm there.
Could you also tell us, like, in your own words, what do you think we can do to strengthen the healthcare system?
Well, on the first and foremost basis, I think we need to formulate an independent body, which is, minus all the government interference. We have so much red tape everywhere in the government bodies that by the time a particular, plan is implemented, it's already buried. Another thing is, I feel the proper utilization of funds is required and stop wasteful spending. This having a Chhatrapati Shivaji Maharaj statue spending 3,600 crores in the middle of the sea is not going to help anyone. First and foremost, a country has to have their infrastructure in place. A healthcare body system has to be in place. And then you can go ahead and, create multiple avenues of spending.
Dr. Lad, sorry to interrupt you. Sir, your video is not on.
Yeah, I'm sorry. I'm not able to start it. There's some dual device which is interfering with my web camera.
Okay, sir. No problem.
I'll just try and get that sorted. And yes, if I can continue, we need to procure life-saving equipment, drugs, and plan in advance. All our planning right now has been just last-minute planning. Just give you an example, Serum Institute of India had requested the government for a loan or funding of 3,000 crores, which in spite of their repeated pleading, it didn't come through. And now I think they've implemented it or they've passed the loan, but it's come a bit too late.
Yeah, I think you make a good point.
If we have to handle a COVID situation, which is a pandemic, I think we need to be a bit more proactive in our measures.
And not just pandemic, we've gone into full crisis mode right now. And you make an excellent point that we need to also not just react to what's happening, we need to be prepared for it from beforehand.
Absolutely.
And Dr. Mukherjee, I know I said I wanted to bring you in, but maybe this is a good time to bring you in because, mental health is starting to become a topic, and it would be great if we can get ahead of that before that too becomes a crisis. So
mental health is always a crisis. Already it has become a crisis because most of the people who are getting severe COVID are psychiatric patients. We are finding out, we specifically those people who are psychiatrists as well as frontline health worker like me, they are finding out that most seriously affected COVID patients have psychiatric problems. In fact, psychiatric vulnerability makes one too much vulnerable towards bad effects of COVID. Standing there, along with that, the loss of job, the loss of loved one, the loss of normalcy, the so-called normalcy, what we can say, the loss of normalcy in society has made a huge tsunami of mental health problems. And we are literally ill-equipped to deal with it. All over India, there are actually less than 10,000 psychiatrists properly trained clinical psychologists are still fewer in number, and the other areas too low. We are not at all equipped. I really don't know how much we can get at this moment.
No, you're right. This has always been a problem. It's always been that invisible, if you can't see it, then it's not a problem, right? And the pandemic, we can very much see everything, and we can see that we do not have the infrastructure, the resources in place to handle something as dire as this situation. I mean, that's why it became this dire, and not just because of, and this is not just the government's fault, of course. This is all of us. We all collectively, as a society, have made this happen. Dr. Balani, can I ask you to start the next round of questions, which is what parts of the healthcare value chain need investments?
What part of the healthcare value needs investments?
Yes.
So I think right now we need more manpower. So as it is in India, the doctor-patient ratio or the nurses even are low, and those who are working are already falling ill. So that ways, I think it should have been done earlier also. And especially in public sectors also, if there is no oxygen, there is nothing, then the doctors are being blamed for not having adequate equipment to face the crisis. But then the doctors are not responsible for that. So these are coming into highlight now that they had asked for these, but then it was not provided in that sector. So everything is now coming into highlight how deficient we've been throughout.
Yeah, and but the thing with manpower is that, it obviously, even if we put money into it right now, we cannot expect results to come in immediately. We will have to wait some time. What is something...
Vasudha, excuse me, Mr. Sudhir Mishra has joined. If we could just introduce him to the rest of the panelists.
Absolutely. Mr. Sudhir Mishra is the founder and managing partner at Legal Trust. Welcome to our discussion. We're talking about strengthening the healthcare infrastructure.
Thank you. I'm here. I run the firm Trust Legal, not Legal First.
Oh, sorry.
And you want me to talk, but I think you are already some panelists is speaking, right?
We were talking about the healthcare value chain.
Okay. So I'll tell you what is my take on this entire thing. I have been, for last 7 days, I have been mostly in the Delhi High Court for various hospitals, asking for oxygen for them. I was appearing for Venkateshwar Hospital for last 5 days. I've just come back from court. I was thinking this conference is from 6 to 7, so I was not very prepared. I just changed and came here. But let me tell you, all the sectors of healthcare need massive investments. I'll tell you something very dramatic. Today, the Bar Council of Delhi, which is the apex body which regulates us, the chairman of Bar Council of Delhi broke down in the court. He said that how will you save people, your 3 crore taxpayers who pay you these kind of taxes, which can be a pride in any country of the world, and they are dying because you are not treating them for COVID. You are not able to treat them for anything. So one, you die because you have COVID, you have a complication, that's a different issue. You are dying because you have no remedy, you have no medicine, you have no oxygen. And if you ask for oxygen, then the state will tell you that we'll file a FIR against you. So you are living in this kind of situation. This is not the time to think negatively, but the fact is that I get more calls from lawyers, judges, senior advocates who know that we work for healthcare and for a lot many hospitals, that you provide us some oxygen or provide us some bed in some hospital. And if you know what is happening in National Capital Region, people are going to far-flung areas, to Ludhiana, Karnal, Rohtak. Is it something ordinary? You think that your investment is the issue. The issue is that our priorities are different in this country. And that's why you are going for this kind of mass deaths, which the whole world is laughing. The whole world is watching you on all the TV channels. The whole world is seeing you, that you have big stadiums, big infrastructure. You are sending to moon and Mars, where not, but you don't have oxygen.
No, I don't think you're being negative at all, but it is a time to be realistic and to be practical and to look at exactly what we have and exactly what we need. And right now we are in need of a lot. That being said, like, we're just talking about how we need to invest in manpower, but all these investments will take time. Like, even if you invest immediately, it will take time for these things to come. What is something that we can do now? And I'm sorry to put that burden on you.
You are asking me?
You may answer if you like, and then we can move on to other panelists.
I'll just say briefly, and then you can go to the other. See, first important thing is that you have to induct more people in the healthcare sector on an ASAP basis. So you have to get the nurses, the final years nurses, you have to get doctors who are waiting for some kind of recognition from MCI, or if they are from some bridge course from some other country, you have to allow them to come inside the hospitals, because you need young legs now. They have tired legs. The entire hospital chains for which I work, I can see they are exhausted. Even if we ask a doctor to help a patient today, we know that they are not even able to talk normally. All of us have not slept for 7-8 days, who are doing petitions after petition for oxygen in Delhi High Court. So I know the real situation is very alarming. You need to induct whosoever you want to induct. You have paramilitary forces, you have army, you have state polices, you have railways, you have specialized hospitals for different purposes. Get all of them. Get all of them to support the COVID teams across the country. That's your first measure which you have to do. The second thing is Delhi needs to find more tankers to carry the oxygen, because you can ferry these tankers with an aeroplane to any place for refilling, but you can't bring them in the aeroplane because of the security reason or whatever reason is that, scientific reason. So I think these are the two things which is worrying me, that Delhi needs higher allocation, Delhi needs oxygen availability. And when I see Delhi, Delhi means National Capital Region. And the second thing is the ramping up of healthcare professional infrastructure within 48 hours to 72 hours.
Thank you, sir. Thank you so much. I would just like to move on to Dr. Mamta Shah. Dr. Shah, could you tell me what will telemedicine and digital OPDs help in the near future?
Yes, I do believe it will definitely help, and it has been helping. My practice is right now completely online. So I do teletherapy. I either do it on Skype, Zoom, or on the phone if people do not have those services. And I think people have also begun telepsychiatry also for the medication part of it. So I do think it is helping quite a bit. People are getting, so it's not only within the same city, right? So anyone can kind of get help from anyone. So while I talked about the not having proper mental health care in within the insurance framework, I think a lot of I know within the psychological and therapeutic field, a lot of people are doing concentrating on maybe 15 to 20% of their practice in low fee work with people. So they're trying to incorporate as much as they can, but with the kind of the volume of work, which has increased tremendously, I think that gets filled up really fast. So instead of doing more, long-term work, we are doing short-term work and, trying to just work with people's symptoms at the moment, and then, having them to, terminating them as they're feeling a bit better. And then, in case if anything crops up, they have an opportunity to, of course, come back to therapy. But so there's a lot of work going on in telecounseling, basically.
Thank you, Dr. Shah. Dr. Lad, what would you like to say about this?
Well, at least in my field, I don't think medicine or tele-dentistry kind of thing exists. But I definitely feel that most of our population is rural based. So instead of them rushing straight away to, tertiary care centers, they can be easily handled via telemedicine from their own comforts of their own home. And for that, I guess we can create a good network of connectivity and some software which can link them. And now I believe there are cases where even an ECG can be read on a WhatsApp by many doctors, and it's being sent across from the patients to the doctors. So I guess telemedicine does have a big role, and especially now in COVID times where, the uneducated really do not have the patience and the education. They just want to run straight primarily to the healthcare center. So if they are dealt with a lot of tact and love, I guess the load on the hospitals will reduce.
Thank you so much, Dr. Lad.
Dr. Lord, actually, I would also like to ask you a question, since you are in a slightly different field. Like, what parts of the healthcare system do you think that government can still tap into to invest in, or to get more manpower from, or you can, use more at this time of crisis?
Sorry, I couldn't get you. Come again. What?
Oh, great. I said, are there any parts of the healthcare system that the government can still tap into, that we can still use to get manpower or, professionals from, and that we can use more during this time of crisis?
Well, Dr. Shetty, who is a very famous surgeon and the chairman and founder of Narayan Healthcare System. They have about 21 medical centers all across India. So he had rightly put forward a system where he said that right now the need of the hour is about 3,500 healthcare workers. And he was talking about a system where there are about 2 lakh nurses who are about to appear for the exams, who have already qualified, finished their studies. And he brought about a very interesting scenario. What he said is that do not get them into the examination mode right now, inculcate them, incorporate them into the ICU setups, let them work for 1 year, and then on the basis of their performance, you can give them a degree. So straight away, you're getting 2 lakh extra workers there.
That's really
that
important.
Even for our health, even for our students who are finished the MBBS and they're waiting to give exams for their NEET, they can be given a straight away, conduct an online exam, give the results, declare it quickly, and induct them into the treatment programs. There's no need to wait for, seeking any outside help.
Yes. Get them into the practical section. Sorry.
You can go ahead, Russell.
Yes. Dr. Mukherjee, I would like to ask you the same question, because you are in the healthcare system, but maybe not directly involved in the crisis, but what are some of the areas of the healthcare system that we haven't tapped into?
At present, I am directly involved in COVID care because we don't have that much manpower. So the earliest resources that we can acquire is Army resource. Army has a huge medical corps that can be utilized. Number 2 is we need to do more allocation of COVID beds. Number 3, every year India produces 70,000 MBBS students. And if we add the people who are doing the same graduation outside, then the number goes around 1.2 lakhs. We need to bring them in as early as possible, as already the previous panelists said it. Along with that, we need to find more medical professionals from outside the India. Let's say a huge number of Indian diaspora living outside India are actually into medical profession. They can chip in, and they are actually chipping in. They are forming various tie-ups with us, and they are trying to help. So help is coming, but the problem is the number of bed and the oxygen crisis that needs to be sorted out fast. Otherwise, we won't be able to keep the people alive. We need to keep them alive.
Absolutely. Like everything, it seems like all our solutions are just ahead of us, they're not quite there yet. But there are, like you said, there are possibilities, there are options that we have, much more than what we have maybe used so far. Going back to a question that my colleague Kavi asked, Dr. Shah, can you maybe tell us, there are a lot of professions in which you can use telemedicine, like OPDs, digital OPDs, but like Dr. Gautam mentioned, for dental situations, you can't do that. How do we deal with that? How do we deal with situations where telemedicine is probably not possible? Or how successful is telemedicine in all fields of healthcare?
I'm not sure if, telemedicine would be helpful in all fields of healthcare. Maybe at a primary level it would be, but, where other things where you do need to work on the patient, I guess it would be difficult then, definitely. But let's say at that level where, just the you just have to take care of the medication part of it, or just have to see for follow-up cases. I think that's the time when I think that would be possible. Yeah.
Dr. Balani, would you like to chip in?
Yeah, I was just wanting to say, because this is like an emergency and our healthcare system is more state dependent. So every state is trying to cope up with all the deficiencies they have. It should be right now, it's because it's an emergency, it should be dealt at a central level, allocating more resources to the states which are badly affected, and then kind of distributing it evenly all around.
But what about situations like we said, where maybe teleconsultation is just not possible? How would you want to get around that? I mean, as a dermatologist,
yeah, so whenever procedures are required, teleconsultations are not possible. But yes, up to a certain extent in COVID also, if we are actually doing a video call and seeing the patient's condition, and then up to a certain level, they are being managed. So yeah, of course, everything has its drawbacks.
Yeah. Unfortunately, we're in a situation where we just have to see what comes and deal with it the best way we can.
Vasudha, I'll just ask Mr. Mishra a question. Mr. Mishra, how do you think that we can take the healthcare expenditure to 6% of GDP?
I think the state is not going to do that. Let's be very clear, because the state has a lot of other priorities. When you are not able to directly transfer in the bank accounts of people money like many developed countries, actually you can't expect them to have a higher allocation beyond. Maybe they will do 1% more, which will be sizable if they do that. You can't take, you are actually spending close to 1.5%. So if they do 1%, it will be 2.5%. Most of the developing countries do around 5%, 4 to 5%. And developed countries do around 7% up to 9% or 10%. In my understanding, what is fundamentally going to change now? When citizens know more about how to put an oxygen cylinder, how to put a nozzle, what is oxygen concentrator, all these things now every ordinary person knows. So once this tsunami will go away, once we'll be educated by this tsunami, and we'll have there are eminent doctors here who will talk about the herd immunity. What I'm hearing from the society, that society for good reasons now will start investing the private investment in healthcare. So we will go the US way, where basically we'll have large healthcare infrastructure, which will be much more large. especially for urban cities, you will see investment coming in. And if you talk to the Quadria Capitals and Blackstones today, that's what they are talking about. That healthcare, nobody will now say no. One, whether you like it or dislike it, people have really made a lot of money. Ambulances for 5 kilometers, if you are being paid 10,000 rupees, even a limousine won't get that in New York. That you are getting in Noida. So if that kind of money you can earn once in a while, it's whether we like it or dislike it, people will invest money now in diagnostic, all kind of daycare centers, daycare surgery, oxygen plants. You will be surprised when we were dealing with this oxygen matter today also. It was supposed to be a dead industry because medical oxygen was not something where a lot of industries were involved. Because जितनी जरूरत है उससे ज्यादा हम प्रोड्यूस करते हैं, बाहर भेज देते थे. आज हम पूरे कंट्री का ऑक्सीजन को रिकैलिब्रेट कर रहे हैं. वी आर टेकिंग इट फ्रॉम द इंडस्ट्री एंड अदर प्लेसेस, बट यू सी द कंडीशन ऑफ all these healthcare medical oxygen companies. You will realize a very interesting fact. None of them were hugely profitable ventures. It's not like a Infosys kind of business venture or a Swiggy or Zomato kind of thing, which is very futuristic. It is a crisis which has come to you for the first time. It might not happen ever again, but yeah, medical oxygen will be something which people will remember for generations to come.
Thank you so much, Mr. Mishra.
Can we ask the same question to Dr. Mukherjee? Would you like to also give your input? About how we can get the government to healthcare expenditure to 6% of our GDP, which I know is a loaded question. But
it is a loaded question, because I would agree with Mr. Mishra that yes, in no condition our state is going to do that. But we are definitely going in the US way, and ultimately we would get huge infrastructure, but very costly infrastructure, and ultimately we don't have social security. So our poor, our middle class won't be able to avail that infrastructure anymore. So it would be more like Brazilian healthcare, a deadly healthcare.
Yeah, I agree with you that maybe the government will not be able to do that. In 2012, I was actually, when I was in college, I was part of this campaign called 9 is Mine, which was to get the government to fulfill its promise of 3% GDP to healthcare and 6% to education. And neither of that has happened. It's 2021 now. But can I get the other panelists, like, what do you think? Would you like to comment on what Dr. Mukherjee and Mr. Mishra has said? Dr. Gautam?
Well, the thing is that, first of all, our priorities are not towards healthcare. So unless and until our priorities are towards healthcare, it's impossible to get our GDP up to 6%. More so, our defense budget, unfortunately, is 2 times our healthcare budget. And in such times, we need to decide our priorities. It's almost, our defense budget is almost 4,000 plus crores, which is I guess according to the politicians is still negligible, but that's where they get their kickbacks.
Yeah, definitely. But even if we increase it, because dental hygiene isn't something that necessarily is covered by most insurances. So even if we were to get, by some miracle, 6% of the GDP to go into healthcare, how would that affect your practice?
Well, our practice predominantly, as of now, there is no dental insurance in India. And that is the need of the hour, because our dental treatments are expensive. And the whole idea is that the basics of any development of any person is to have a good sound oral hygiene. We have seen people coming into our OPDs at the age of 12, 13, having their first molars missing, which is one of their primary teeth to chew from. And when we realize this, that patients don't have the time, you can't expect a middle class man to leave his work and come for a dental treatment. For such things, dental insurance is the need of the hour. And I think the government should work wholeheartedly into implementing this.
Yeah, I think it's really interesting because we have a panel here, full of doctors right now who's, even if we were to have insurance, most of the stuff would not be covered. And yet they are all incredibly important, incredibly necessary for our healthcare system to grow. But I mean, right now we can't even handle a crisis. So how can we even have this conversation, right? But since we're having this conversation, we need to try to get everyone involved together. And I think Kavi was about to say something. Sorry.
Yes, thank you, Vasudha. What I want to ask everyone, I just want everyone's view on this. Like, what should be the roadmap from now for building robust, affordable healthcare across the nation?
Let's start with Dr. Balani.
Yeah, so first of all, as we have seen, the GDP needs to be increased, the allocation of resources, funds, everything. And private-public collaboration should be better, since we have seen that the private hospitals are doing better as such, but then they are not affordable by all. So more of insurance, more of public and private collaborations, more newer technologies, more better prepared maybe for at least, if not to handle such a big crisis, but at least we should be 40-50% ready to handle any crisis.
Yeah, absolutely. Dr. Shah?
Right. I think the need of, what is needed in the mental health care sector is that mental illness has to be, at par with physical illness, has to be envisioned in that sense. And especially through the insurance agencies and companies, because if they allow that to be at par, then people will be much more open to go and get help also. A lot of people are not getting help, because it is expensive, to get therapeutic treatment, because it's also a bit long term rather than just a procedure. It's not a procedural thing, but also the whole taboo around it. If it is envisioned at par with physical illness, perhaps people will be saying that, okay, it's okay to go and seek help. It's okay. So I think there are two things that can go hand in hand with this.
Absolutely. And like Dr. Mukherjee mentioned, that he's seeing that more people with who have mental illnesses or issues are more likely to get corona. So Dr. Mukherjee, would you like to also pitch in here?
Yes. For improving our healthcare and make it robust and affordable, we first have to change our priorities. We have to understand statue building is not our job. We have to understand having world's biggest stadium is not our job. Our job is to have a healthy population. Our job is to have a sustainable population who can get some good quality healthcare. And India is actually earns quite a good money from medical tourism. So it's not that India has a very bad health quality. The problem is government doesn't understand health. So government has to understand health. Government has to allocate funds to it. Government has to change its direction. And along with that, we have to understand that for improving healthcare, we have to have a social security. Ideally, a kind of social security scheme where the poor can get some help from government in sustaining themselves. Only then we can get a robust and affordable healthcare system. Otherwise, we are going at Brazil's way. We are not going at America's way. Oh. That's the biggest problem.
I think that's a good comparison to put things into perspective. Dr. Gautam?
I think we need to start at the grassroots level. You can't reach the top of the ladder without stepping on the lower rungs. Start from the grassroots level, start from the villages, increase the sanitation aspects, oral hygiene is also part of it. Just general hygiene levels. Prime Minister had started this campaign where they were providing toilets in every houses. go on a mass scale level and try and prioritize your needs, have a proper plan in place, set some goals, targets, and implement it and reach there. And make our politicians accountable for it. Because here we just keep reading about scams after scams, and once again the funds will be diverted into our healthcare industry, and again there will be misappropriation of funds. Have a private body which is independent of any government control. You can get retired IAS officers, elite the best brains in the world, in India, and get them to formulate a proper structure and then implement it.
Yes, we do need a complete refresh. Actually, if you had a refresh button on India and like redo from the ground level to up. Mr. Mishra, can you pitch in here too?
I would say that fundamentally, I did a LinkedIn post 7 days back. I'm quite active there, and more than 75,000 people follow me from the legal community primarily. I said a very interesting thing. I said, if you will not ask for anything, how will the government will give you something? We ask for a mandir, they give you the mandir. We ask for a uniform civil code, they give you the uniform civil code. You ask for 350, 370, 380, 390, they will give you all of that. आप उनसे बेड मांगिए, ऑक्सीजन मांगिए, अगली बार वो भी दे देंगे. आपने मांगा ही नहीं कभी. You never asked. It was never your priority. Most of the middle class people like me who are running from one pillar to another pillar for oxygen and beds today, they never had a problem in their living history. Middle class का हमारा तो यही अप्रोच है ना, हमें क्या लेना देना इससे. हम तो वेदांता में चले जाएंगे, मैक्स में चले जाएंगे. अब जाइए. So the problem is this callousness of ours, this apathy of ours, this disconnected of nature of ours. Why I'm saying this, there is a reason. I fight the biggest air pollution matter of Delhi, which is pending in Delhi High Court, called Sudhir Mishra versus Union of India, for 5 years. Now, when I filed it in 6 years, when I filed it in 2015-16, there was a National Green Tribunal, there was a Supreme Court, which already had air pollution matter against Ministry of Environment, Forest, Pollution Control Board, blah, blah, blah. I filed it against Ministry of Health, Family Welfare. Why did I file it? Because I said it's a health emergency. So everybody laughed at that time. That became a best petition. And today, most of the odd even and everything was decided on that. Thank you. I'm rushing for a court. Excuse me for...
I think Mr. Mishra has left.
Yes,
so
you.
Yeah. So that's all right. You can still continue this discussion. And before he left, Mr. Mishra was talking about how he filed for this petition, right, about odd even and pollution. And I think he made a really good point here. And we all are talking about this. We're more of a society that thinks, thank God that wasn't me, instead of, oh, that could be me. And if we change that mindset, a lot can change. But at the same time, we live in a country where everybody has problems. Everyone is having some crisis in their day-to-day lives. So, I mean, it's not really always, even though this is eye-opening and it's not always fair to ask them to be conscious about everyone, but I think it's absolutely time that we do ask them to ask for more. And if nothing, India, we do like to bargain, right? We like, wo hum 100 bolenge, wo 500 bolega, फिर we somehow settle on 250 or something like that. And we can't just ask for, we need this many, but we have to ask for more. We have to ask for, utopia to get our basic necessities. At least that is my opinion. But moving forward, I mean, here is the $1 million question. And I'm sorry to put that on you, but I think everyone wants to know, how can we tackle Corona? I will let you can decide who wants to speak. I don't want to call on anyone.
Okay, I'm starting. COVID is actually, if seen in perspective, one of the mildest pandemic of human history. Yes, people might get astonished, but it's true. The pandemic with which we can compare it is Spanish flu. Spanish flu killed at almost 50 times more people than COVID. Anyway, so by 2024 to 25, COVID would become a normal cough and cold infection. So COVID control is more dependent on building up our defenses, means making our people last through these things. We have to make our health priorities better. We have to make our care of the people better, because most people suffering from COVID doesn't show any symptom. Around 80% has no symptoms. Amongst the less 20%, around 90% can be treated with basic oxygen facility, basic medical monitoring. So we have to provide that only. But presently we don't have that. Once we get that, once this seasonal outbreak is over, we would be getting some time to bolster our defenses, to make our priorities count. Let's hope we are not going to destroy that.
Thank you.
Thank
Dr.
you.
Sudhir.
I can go next. I do understand what Dr. Bhaskar was talking about, but one of my patients said something that it's mild until it happens to you. So when you've experienced the loss of someone very close within your family, I think suddenly it becomes a huge thing, and I think so the perception shifts from it being one of the mildest pandemic to something which is huge, something which only happened to me. That's the perception shift. I think with the system breakdown, which we are experiencing at many different levels at different organizations, I think now one of the ways to tackle the corona pandemic is to again have a shift in perception, to look inwards and look at yourself and think about, how can I protect myself and my loved ones? I think the responsibility needs to be, shifted from outside to inside now. And I think that is perhaps one way to tackle it. Yeah.
Thank you, Doctor.
If I may go next.
Yes.
I feel, first of all, the fear factor has to be reduced. What we dealt with it a year back was like, everyone was sanitizing, everything coming into the homes. And now we know that it is not predominantly a surface transport, it is an aerosol and a droplet infection. So as and when the people have started evolving and the knowledge about the corona has got widespread, the fear in the people's minds and the hearts has to be elevated. Secondly, I feel that the social distancing norms, we feel that yes, people have got vaccinated, so we can go out and mingle around. It's still not true. You can still get infected in spite of getting vaccinated. So that message has to be driven. And the vaccine is available for all, and make it mandatory for all. And now is not the time to have these restrictions for any particular age group. Whoever is able to get it, go and get it. Because initially, when they started the vaccination drives for the healthcare workers, there were almost 40% of the vaccines going waste because people were not coming forward. So open up the registrations, let whoever wants to take it, and make it available for all.
Yeah, absolutely.
Dr. Lal?
US has about 550 million vials of vaccine just lying there. They are the Pfizer vaccine is lying there in mass scale production, and I don't understand why are they not being pressurized to diverge with those and donate it, or even sell it to the other countries. If you see, 40% of the vaccines produced in India were exported, whereas UK and US has not exported even one vial of vaccine. So primarily, we have to vaccinate our population first, and then go ahead with the donations.
Dr. Lad, I just want to ask you one more thing. During this peak time of complete, the fear factor, as you also said, what do you think? What is your prediction? Like, how are things going to be over the next 30 days?
As I said, if we do not maintain social distancing, if we do not go ahead and provide vaccines to our population, if we do not increase the number of ICU beds, incorporate some firm measures and increasing our force, the healthcare force, I think it's going to be a grim situation. We are in for another serious healthcare scare. And this is not even the beginning of the third wave,
Yes.
where all over the world they're saying the third wave is going to hit soon.
Dr. Belani, could you also tell us what do you think we should do to tackle Corona, and what do you expect to see in the next 30 days?
Yeah, I also feel that we should work more on the panic factor and more of educating people, more of responsible people of the society carrying forward the message of vaccination. Like, see, my maid who is above 45, she didn't still want to register. She was still afraid of the vaccine. So I just told her that I have taken 2 doses and nothing has happened to me. So like that, we need to convince more people. This was like uneducated, but there's still many of my patients who are educated, but still they're afraid of the vaccine. So it's actually everybody's responsibility to educate one another and get them motivated for the vaccine, of course. But that will also take more time because 2 doses are required and people are getting positive after 1 dose and all that. So right now, I think, yes, we still need to tackle with the peak. Maybe 2 to 3 weeks more it will take to start subsiding. Till then, we have to cope up.
Yeah, absolutely. And it seems like we have 2 sides here, right? Like, we don't want the public to panic, but we do want the government to feel the urgency and the need of a better healthcare, more investment in healthcare. And it seems like the both are getting meshed up, where we have the public panicking and the government not maybe taking it seriously, but not acting on it as quickly as we want them to. So those are the 2 things we need to balance out. How do we get the public to calm down a little bit? And how do we get the government or the people in charge, whoever that may be, internationally, globally, government, private, whoever is in power, to take it more seriously? So I would like to ask you, what are you doing in your power to help overcome this crisis? Anyone can start.
Well, as a healthcare individual, what I can say is that it's our duty to educate and spread the message of this COVID vaccine, COVID scare. Inform the people that social distancing, wearing a face mask is very important. So what I have done is, in my society at office, in the office space, as well as in my society at home, I make it a point to distribute free masks to them. So, at least they are motivated to wear it. And wherever I see people, spitting, I try to educate them and inform them that the COVID scare is still not gone away. It's pretty much there.
Yeah.
So from as a dentist, I'm not on the first line of fire like how other doctors are, but we are equally susceptible to the infection through aerosols. So wearing proper mask, education, and just spreading the awareness is what we could do.
I'm also doing a lot of tele consultations, although I'm a skin specialist, but right now I've reached out, sent a message to all my patients also who were coming to me that they can consult me for COVID also. In fact, like the mild cases, of course, but then there are a lot of friends, relatives also who have reached out, patients who I speak to also daily. If somebody is positive and I have prescribed something to them, I make it a point to call them daily, do a follow-up so that they don't panic, and I'm trying to reduce the fear factor so that probably they don't need the oxygen or the hospitalization which is happening.
Thank you. I think
Vasudha,
Dr. Bhaskar had to. Yes.
Vasudha, Dr. Bhaskar just sent a message that a health emergency came and a COVID patient has become violent. He's needed at the ICU, so he had to leave abruptly.
Yes, and of course, we don't want to keep anyone from getting from their work. We all know that you're very important. We need you right now. Even if you're not on the front line, everyone, it's all hands on deck situation in India right now. So just quickly, Dr. Shah, could you also tell us what are you doing in your power to overcome Corona and health?
Well, I think the most important thing is to understand that the fear and anxiety that we're going through is rooted in reality. Generally in my practice, we get a lot of people with anxiety disorders, which it's not rooted in reality. But in this case, it is. So that itself, I think, helps people to see that, whatever they're going through is not so much out of the normal. And I think that's really important. The other thing is also, which is a difficulty is that even the cases of depression are increasing because now people are losing people around them. And to top it off, they're not able to basically do any grief work because to top with the depression or with the sadness that they're going through, there is still anxiety that something may happen to them. Again, trying to get them to see that both of these feelings are okay to have within a person. And I think the important thing is to talk about it rather than keep it inside of them and have various stories that, emerge in their mind. And of course, I do work with, even with friends and family on this respect. And, trying to just keep your mind at a level which is, which doesn't go to any extremes is really important.
Yeah, absolutely. So just to wrap up, in the last episode, Dr. Batra actually asked everyone, what can us as the media do to help people, so I would actually like to ask all of you the same question, we are here right now, we are listening. Tell us what we can do to help people, whether it's to, other than spreading information, is there something we can change in the way we spread our information, in our tone? What can we do to help with this panic? Anyone can start again.
I'll just continue from what I was saying earlier, is to normalize the fact that, mental illness is going to be an outcome of this, and it's okay to seek help or to talk to somebody about it rather than keep it inside of them. So maybe that kind of a message can
maybe spread. Yes.
The media can spread more positive messages also. Of course, death news are always there, but then news like an 85-year-old survived, although her oxygen had reached 65 or so, and then she survived. Such news should actually be the headline so that people get more motivated.
And should that news come in, I think we'd be more than happy to take it up. But I think we're also not getting reports on those. And I think you make an excellent point. That is something that we should definitely look into, try to get more, if not positive, but not negative, maybe some neutral messages. Last week, actually, Dr. Lalumani talked about how, you could give the bad messages, but maybe don't have it on the front page, have it on the second page. You give information, and even Mr. Mishra, he had to leave, but he talked about how, in Hindi newspapers, they are actually the first page, you would see how they're more controlled in their in their narrative. In the first page, you maybe see how education based, how what we can do, how we can do it, and after that they talk about the news that not the negative news, because it is factual. Unfortunately, it is happening, but it doesn't have to be frontmost, foremost. The first thing you see in the morning, as soon as you wake up with your tea, is dead bodies and all this. Dr. Gautam, would you like to add to this? Please, anything you can tell us?
Yes, so it's a known fact that sensational news is negative news, and that sells. So, there are a lot of good things happening around. People are volunteering, tirelessly. There are some voluntary drives happening, which can be highlighted by the media. A lot of doctors are working tirelessly that can be highlighted. And I think there'll be definitely a change in the mindset in the people's minds.
Yeah, I agree with you. And we do have a lot of good news. I mean, so we can also like add to this. We have a lot of, so much technology is coming out of this, so many apps, so many ways for people to connect with each other, support each other during this time of crisis. But thank you everyone so much for coming here and taking time out of what I can't even imagine a busy day you must have and busy time that you're going through, and speaking with us today and answering all of our questions. Kavi?
Thank you so much, everybody. This was very insightful, and I'm not saying it just like that. It's truly been very insightful. I've learned a lot. I've heard views from all of you, which are enlightening and which are important as well. And I thank all of you for taking out time from your very, very busy schedules and being with us. Thank you so much.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.